Hello, thank you for giving chance of announcement. I'm Jung, the doctor of Keimyung University, Dongsan Hospital. Today, I'd like to present the study entitled Characteristics of COVID-19 patients who progressed to pneumonia on follow-up chest radiograph. 236 patients from a single isolated cohort in Daegu, South Korea. In December 2019, the novel coronavirus disease 2019 COVID-19 outbreak occurred in Wuhan, China. In Korea, the first COVID-19 patient was diagnosed on January 20, 2020, and in February, the number of COVID-19 patients had increased rapidly, particularly among a certain religious group in Daegu City. On March 11, 2020, the WHO declared the COVID-19 outbreak a pandemic. The Plasma Society states that imaging is indicated in patients at risk of disease progression with a worsening respiratory status. Therefore, it is important to identify the characteristics of those who develop pneumonia and need further imaging. Several recent studies have reported that chest radiographs or even CT may appear normal in the early phases of infection. Thus, in hospital bed restaurant situation, it is important to predict who will develop pneumonia and require treatment. Purposes of this study are to investigate the prevalence of pneumonia in COVID-19 patients using chest radiograph and to identify the characteristics of those with initially negative chest radiographs who were positive for pneumonia on follow. Our institution was designated a cohort hospital for COVID-19 patients. A total 236 patients were admitted to the hospital between 22nd to 27th February 2020. All of them are subjects in this study. In this cohort, 60.2% of patients belong to a certain religious group where community infection was suspected. Most of them had mild symptoms and not requiring intensive care at the time of admission. 12 patients were asymptomatic. Patients' demographic data, underlying diseases, symptom types, and symptom onset dates were collected. Initial laboratory results and data on clinical severity were obtained. All patients underwent initial chest radiography at admission, and follow-ups were taken every 2 or 3 days. All images were reviewed by 2 chest radiologists. We classified patients into 3 groups. Patients whose radiographs were initially negative on admission but subsequently developed pneumonia were classified as the positive conversion group. Patients with pneumonia detected on the initial radiograph were classified as the initial pneumonia group, and those patients with no evidence of pneumonia on initial and follow-up radiographs were classified as the non-pneumonia group. Among total 236 patients, 45.8% were in non-pneumonia group, 29.2% were in initial pneumonia group, and 25% were in positive conversion group. The clinical characteristics of each group are summarized in this table. The mean age was significantly higher in the positive conversion and initial pneumonia groups than in the non-pneumonia group. Chill and myalgia were observed significantly more often in the initial pneumonia group than in the non-pneumonia group. Initial pneumonia and positive conversion groups had significantly more hypertension than the non-pneumonia group. Initial C-reactive protein CRP and lactate dehydrogenase LDH levels were significantly higher, and the absolute lymphocyte count ALC was significantly lower in the initial pneumonia and positive conversion groups compared to the non-pneumonia group. The number of severe pneumonia and ICU admission was significantly higher in the initial pneumonia group than in the non-pneumonia group. The table summarizes the results of univariable and multivariable analysis for finding predictors of positive conversion. On univariable analysis, older age, underlying diseases including hypertension and diabetes, lymphocytopenia, higher CRP, and LDH levels were significant predictors for positive conversion. On multivariable analysis, older age, lymphocytopenia, and higher CRP level were significant predictors. The time interval of chest radiographs taken after the initial symptom onset is summarized in this table. In the positive conversion group, the initial radiographs were significantly obtained closer to symptom onset than that of initial pneumonia group, and follow-up radiographs showed pneumonia within a median of 4 days after the initial ones. Overall, in both initial pneumonia and positive conversion groups, chest radiographs became positive at a median of 8 days after symptom onset. Here is the case of the positive conversion group. 67-year-old female with history of right mastectomy due to breast cancer with increased CRP and LDH level and decreased ALC. Radiographs were initially normal, but pneumonia was detected in the follow-up taken on 3 days after initial imaging. There are several limitations to this study. First, this study was conducted using chest radiographs obtained in the erect position in the PA direction. Second, this study may have a selection bias. Third, not all the chest radiographs were compared with chest CTs. Therefore, the possibility of false negative cases may exist. First, we did not detail morphological features such as consolidation or GGOs. In conclusion, although a considerable proportion of patients with COVID-19 showed normal chest radiographs initially, older patients with abnormal laboratory findings progressed to demonstrate features of pneumonia on follow-up chest radiographs. Thank you for your attention.